Hello, I'm John Medine, founder of Save the Arms, the producer of sports training aids dedicated to reducing arm injuries and improving throwing and pitching performance of our youth. Sports medicine specialists say that in the past 15 years, arm injuries in youth baseball have reached almost epidemic proportions. Fortunately, organizations such as Little League International and Pony have begun to address the problem by enforcing strict pitch count limits and rest days. One of the major contributors to the stream of injuries is incorrect throwing and pitching mechanics. The majority of youth baseball players throw incorrectly, using mostly their arms and far too little of their bodies. Pros throw with their body by first rotating the hips and then fractionally later the shoulders. The sports medicine and professional sports communities refer to this as the kinetic chain. Notice in these pictures, the hips are rotated nearly 90 degrees, yet the shoulders have not begun to turn. Orthopedic surgeon, Dr. James Andrews, and Dr. Glenn Fleisig, principals from the American Sports Medicine Institute, in a presentation to the Little League International Congress, cite incorrect mechanics as a major contributor to arm problems. In the presentation, which can be viewed at littleleague.org, Dr. Fleisig describes the hips rotating first and then fractionally later the shoulders as key to proper mechanics. Dr. Ben Kibler, fellow of the American College of Sports Medicine, renowned expert in the field of proper throwing mechanics, and frequent advisor on youth baseball arm injuries, agrees that the correct use of this kinetic chain is vital to preventing injury. What we have devised is an inexpensive, easy-to-use training aid to teach the correct throwing motion. Our device is a simple visual aid that shows players, coaches, and parents when proper mechanics are being used and when they are not. It teaches players how to use the body to produce velocity instead of relying solely on the arm, which is a sure ticket to shoulder and elbow strain. Remember the pictures of the pros? If they were wearing this training aid, the cord would bow out this far because the angles between their shoulders and their hips approaches 90 degrees before their shoulders begin to turn. This is your goal, to throw like the pros and cause the cord to bow out like this. If we were throwing like most youngsters, not using the kinetic chain, the cord would remain flat or even stretch. To begin protecting the arm and improving performance, click Order. To learn more, click Supporting Info.